to save the Jarrow Walk In Centre. I'm delighted to say the sun has now come out and is shining quite rightly on people who are here to protest against a decision that's been made which we want to stop, and we want to make sure that the walk-in centre is there for the people of Jarrow and Hebburn for always afterwards. So today we've got a whole range of speakers. I'm Merv Butler, I'm chair of the South Tyneside Public Service Alliance. Our alliance was formed in July 2010 after the coalition government came to power to make sure that we speak up for and try and protect our public services in this borough. And we're delighted that we've been able to keep those campaigns going throughout the last 5 years, and we want to make sure that our public services are there for everyone in the future. So today you're going to hear from a range of speakers. Our first speaker is Joan Lewis. Joan is President of the Trades Council in South Tyneside, but more importantly, Joan is a service user of the Walk-In Centre and will tell you about why it's so important. Thanks very much.
Hello everyone, I'm going to tell you all a true story today. It started off in 1987 when the late Teresa Walsh and myself had a look round Palmer Community Hospital, which had only been opened about not quite a year. And we noticed there was not a casualty unit or an injuries unit there. So we went on a campaign. It took us 9 weeks. But we walked the length and breadth of Jarrow and Hebburn. We went into every pub, every club with our petition. We stood in Jarrow Shopping Centre, Hebburn Shopping Centre. We even knocked on doors. And our petition was over 10,000. We presented it to the manager of the Health Authority and the chair of the Health Authority, backed by our MP then, Don Dixon. Now we won that battle. We got a minor injuries unit opened in Palmer Community Hospital. It lasted 26 years. The CCG come along and take it away without a buy or leave. Consulted with nobody, because they are just a quango from this rotten Tory government. But I can say we've now got Primrose Hospital, the Walk-In Centre on a life support machine, ready for these people to turn it off. Well, what I say is, if something's worth having, it's well used, it's worth fighting for, and that's why we are all here today. Thank you.
Thanks very much, Joan. Tells it as it is, as always. Our next speaker is Marion Langley, who represents the workers at the Walk-In Centre and will tell you about the impact it's having.
Thanks, Merv. I'm Marion Langley. I'm Branch Secretary of South Tyneside Healthcare Branch. I represent those members in the Walk-In Centre. I also represent the staff at South Tyneside District Hospital. Can I just say that the closure of this Walk-In Centre will mean and it will have a major impact on all of South Tyneside, not just Jarrow and Hebburn, but South Shields as well. The winter pressures that we've had, as you know, up and down the country, every A&E has had major concerns about how we've dealt with winter pressures. I see this closure as a pressure on A&E services at South Tyneside as a constant pressure. We won't have a lax after the winter. We will have a constant pressure if 27,000 people, as the CCG say, are going to go from from Jarrow and Hebburn here to South Shields. On top of which, I'll quote Matthew Walmsley. We have been clear from the start that concerns around access to GPs, transport and raising awareness for and advice available from places such as local pharmacies must be tackled before the move takes place in autumn. The Secretary of State is asking for robust plans put in place before the closure of this service. I'm going to ask you a question, a number of questions. How long does it take to train a GP? How long will it take to get GP practices up and running? How long will it take to get a metro station built next to South Tyneside Hospital, as you've got in Jarrow and Heaven here? How long will it take to get a bus services running every 5 minutes to Harton Lane at South Shields outside of the hospital? How long will it take to get parking spaces at South Tyneside Hospital? Let me tell you, the clocks go forward tonight. It's the onset of spring. As far as I can see, it takes years to train a GP, build surgeries, and get planning permission to build buildings. So I don't see any of the above being done before the clocks go back in autumn. Do you? Please keep the support going. Fight to keep this vital service for the community of Heaven and Jarrow open. One last thing, the NHS is being sold off bit by bit. I deal with the effects of that on a daily basis. I've dealt with staff being chippied out of the health service into private sector, and I've been doing that for months, actually years. Please don't let the Tory boys sell off the NHS. Fight, make sure May comes around and you're registered to vote, and make sure you use it. Thank you.
Thank you very much, Marion. Really important about the election coming up. Our next speaker is another local service user and campaigner. It's Ros Slater.
I would just like to tell you what a lay member of the CCG said on January the 15th. What we are doing will be in the best interest of the patient and public in terms of quality and safety. Now, at the last meeting last month of the CCG, they were asked how many of the 6 points that you've heard other people mention had been tackled. There's only one so far of those 6 points, and that is communication with the GP services, where they've spoken to practice managers, and that has been done by an organisation called Healthwatch. They have been asked to look at 6 things by the IRP. Those were the reconfiguration panel, who we wanted to have a full review into just what's been going on, but we were not allowed that. But they are going to be monitored, the CCG, because they've got to work with NHS, and more importantly to me, and I'm sure to you, they've got to work with the council. And so far, from the 6th of February, when they were told this, they haven't made any plaudits towards the council to even set a programme for what they will be discussing and how they are going to do it. So I do beg you to watch the Shields Gazette carefully, because a little advert in blue and white, not the best colours for people with eye problems, they tell you when the CCG meeting is going to be. And the next one is going to be on the 28th of May down at Living Waters. Now, I'm a little bit concerned about some of the members of the CCG, because Dr. Hambledon, who's the chief officer, sent me a letter telling me that the meetings would be held at South Shields and at Bede's World in Heaven. Well, for somebody who's looking after the health needs of people in Jarrow, who thinks that Bede's World, the iconic Bede, is actually in heaven, I think things are being twisted to meet what he thinks we want to hear. And we want the truth, the whole truth, and nothing but the truth. So I do beg you, please look out for these little notices, find out when the next CCG meeting is, because usually up until the last meeting it's been me and Verity from the Shields Gazette. But at the last meeting, I'm so happy to say we had 12 people there, and they were quite surprised that they had to be accountable. But we want them to make them accountable for all of you here today. So please look out for it. Get there and make them accountable. It's your health service and my health service. I've been down there twice this week, and there isn't even enough people, enough seats for people who want to get in to the walk-in centre. we really must keep this facility and, if possible, help it to grow. So I look forward to your support and thank you for it. Thank you.
Thanks very much, Ros, and for someone who's holding the CCG to account, I thank you for your work on that. It's really important that people understand who's actually making these decisions about your local health services and waking up to the fact that there's very little democratic control in that. Our next speaker represents the National Pensioners Convention, and I'm really pleased that they're here to support the Walk-In Centre today, and that speaker is Jan Short.
Thank you. Good morning, Jarrow. Thank you. The sun's shining at last. As Mel said, I'm from the National Pensioners Convention. I'm a Vice President and have been now, this is my second term. And the National Pensioners Convention fights for all pensioners, not just ones like ourselves who are lucky enough to have reached pensionable age, but more importantly now, for pensioners of the future, because pensioners of the future are going to have it really rough. So today, in terms of the Jarrow Walk In Centre, I hope you'll forgive me when I say to you that the pensioner generation of today, particularly those 75 and over, are the generation that know the history of the NHS. They know what it was like before the NHS, when your health depended on how much money you had in your pocket, either to make you well or not. They were the generation that fought for, voted for, created and paid for the NHS. They're also the generation that saw what the NHS brought in benefits, not just for themselves but for families. And now they are the generation, sadly, seeing it dismantled before their very eyes. And I want to ask the CCGs a question. What happened to the promise about nothing about us without us? Your voice is to be heard. You have a right to be heard. This is about your local town and your local facilities. And Jarrow has a history, a proud history, of fighting for justice and for right and for the cause of its community. Now, as my role of Vice President gives me a portfolio, and I have a portfolio of health and social care, and I have to agree with Marion wholeheartedly, because in the role that I take in the National Pensioners Convention in health and social care, it is scary. Really, really scary. Your NHS is being sold without your knowledge. And I ask you some questions today. For those people who were in work and are still in work, what would it be like for you to have an employer who paid your salary, who paid your travelling expenses, who paid your mortgage or rent for a property, who paid your meals, and on top of all that, paid your utility bills? Well, that is what is happening. Your taxpayers' money is going to pay 780 odd people down in Westminster who really don't want to know anything about you. So what I'm here to say is, any local councillors, any MPs in the audience today, I want you to stand up for Jarrow. I want you to set aside your party politics. Doesn't matter what colour rosette you'll wear in May. What matters is the people that elected you. And they matter. Please, please, do everything you can. And to the people of Jarrow, I wish you so much success, and I hope your walk-in centre is saved, because you deserve it, you need it, it's not broken, so it doesn't need fixed. So all power to your elbow, and thank you so much for turning up this morning.
Thank you, Jan. The Public Service Alliance is really grateful for the support of the Northern TUC, and I'm delighted that the Regional Secretary of the TUC, Beth Farhat, is here to address us. Thank you.
Thanks everyone, and good morning. It's absolutely fantastic to be back here in Jarrow. The sun is shining like it was last year, the day we set off to march from Jarrow to Parliament. And I'm proud to bring greetings of solidarity from the Northern TUC proud to be among so many of you who care so passionately about our NHS, and I'm here to join so many of you today for speaking up for a publicly run, publicly accountable and publicly owned National Health Service. And thank you so much for the Public Services Alliance in South Tyneside for coordinating and organising today's rally, because it doesn't matter what background we're from, whether we're trade unionists, whether we're campaigners, or whether we're NHS workers, we must work together, campaign together to save the NHS that we all believe in and that we all benefit from. And we know what's happening here today in Jarrow is that the CCG review into closing the walk-in centres is being reviewed at the moment to work out where the 27,000 people are going to go to actually if the centres close. Well, we know exactly what's going to happen there is there's going to be pressure on services in South Shields, there's going to be more pressure on services in Gateshead, and the reality is for those 27,000 people, the public transport links for them to get to other services is not exactly great. So it's going to be, there's going to be a lot of pressure on other services and a lot of pressure on people not be able to get the services that they need. Last year, friends, we recreated history. It started here, and the People's March from the NHS was a result of hard work, passion and dedication from a small group of women called the Jarrow Mums. The People's Vote for the NHS is now continuing that campaign, and if marching from Jarrow to Parliament wasn't enough, they're mopping up the rest of the country as we speak, and today they hold their rally in Nottingham, so I'd like to send greetings and messages of solidarity to them as they continue to march through the country, gain people's support in support of our NHS. And all of this hard work in a bid to raise awareness around the growing privatisation of NHS care, the impact of cuts on health services, and to call for the return of the responsibility of delivering NHS services to the Secretary of State for Health. Look, the reality is we're now just over 1 month away from probably the most critical election for the next generation. An election that's going to decide what the country will be like for a generation to come. A Tory future, quite possibly outside of the EU, with a state hacked back to 1930s levels, with public services privatised and 1 million more public sector jobs gone, and actually strike action could be banned by the back door in a naked bid to try and stop unions from doing anything about it. Or we could have an alternative. We can have an alternative where we protect our NHS, we get tough on greed and inequality, and we start building an economy that works for ordinary people, good jobs, fair pay, decent welfare at its heart. I'm delighted to have our Labour MEP with us today, Jude Curtin-Darling, and our local Labour MP, Steve Hepburn, supporting this rally today. The reality is this: the future of the NHS has never been less certain as it is in this current government's hands, as it passes legislation through Parliament to privatise NHS services. And if there's one message we want to send out today from our collective efforts, then it's this. We want to get a message on the corridors of power that we can't privatise our NHS. It's not for sale, and we need to save our local Jarrow Walk In Centre. Thank you very much.
Thanks very much, Beth. That's really great to hear that support. The Public Service Alliance has been delighted with the response of our local MPs to this situation. And Stephen Hepburn, who will be our next speaker, has raised the matter in Parliament, as indeed has Emily Buck, the South Shields MP. And as a result of some of those discussions, the Shadow Secretary of State for Health from the Labour Party, Andy Burnham, has sent this message to today's event. He says, "Thank you to everyone who's turned out today to support the Jarrow NHS Walk-In Centre. The centre is a key part of Labour's NHS policies to enable us to handle the ever-growing demands on our health service. With the crisis we've seen in the NHS waiting times and A&E, I believe it's important to keep these important local facilities, which are greatly valued by the local community. I therefore reiterate my pledge on the floor of the House of Commons on the 21st of January 2015 to your local MP Stephen Hepburn that if he and his community can keep the campaign going and save the Jarrow Walk-In Centre and keep it open, and if I am Secretary of State in May, it will stay open for good. Thank you, Andy Burnham." So we have a clear commitment there from a senior politician for our walk-in centre, and that's what we need. So I'd now like to introduce Stephen Hepburn, MP for Jarrow.
Well, thanks, firstly, for all you've done in the trade union movement to support our cause in Jarrow. Gives me a great boost today, a boost of adrenaline, a shot in the arm to see so many people, users of the walk-in centre, whether from Peelaw, Hebburn, Jarrow, Bolton, who've come along here today to support our case to keep that service open. Thank you very much for taking the time out and coming down. Now, I hate to contradict one of the earlier speakers, but politics does matter in this, because we've been here before in Jarrow. Can you remember the last Tory government? What did they say? What was the cure for the country's economic ills at the time? It was called monetarism. And what did it mean? They closed our shipyards, our coal mines, our steelworks, and brought about mass privatisation. Fast track forward, and what have we got now? We've got Thatcher in Downing Street, this time in a Savile Row suit minus the handbag, bringing about changes that's violently against the working class people in this country. Cuts to public services and mass privatisation again. In no way can that policy be demonstrated better than what we're seeing at our local hospital in Jarrow. Since the Tories got in 2010, they've closed 3 elderly persons wards, they've closed the minor injuries clinic, and now they're going to close our walk-in centre. A walk-in centre that's used by over 27,000 people locally. 27,000 patients that are now going to get dumped on already overloaded GP surgeries and an accident emergency in South Shields. Cuts that have been brought about to pay for the government's national £3 billion reorganisation of the National Health Service Management that nobody asked for, nobody knew anything about, nobody seen, and what's more and more importantly, nobody voted for. However, I see hope, and I see hope on the hillside, because in 5 weeks' time we will get a return of a Labour government, and I look forward then to saving the NHS with a Labour government, of keeping our walk-in centre open, and I especially look forward to seeing some of our public sector workers that have been under so much attack from this vicious government, processing the dual claims of Cameron and Clegg. Thanks for your support. You've been great.
Thank you, Stephen, and thanks again for all you've done in this campaign. I'm delighted to now welcome the Member of the European Parliament for the North East, Jude Curtin-Darling. Now, Jude was here last August when the People's March for the NHS started, and I'm delighted she's back today. Thank you.
Thanks very much, Merv, and thank you to all of you for turning out. When I got up this morning, I was a bit worried when I saw the weather about what the turnout would be like, but as we say, the sun shines on the righteous, and it certainly is in Jarrow today, and it did last year in August when we set off on a fantastic march. I marched from throughout the constituency, from Jarrow to Northallerton, and people came to their doorsteps, people beat their horns, they stopped us, they asked what we were doing, they cheered us on. The whole of the route down, it continued down, it built to Parliament. Fantastic mobilisation, but mobilisation is only good if it results in a change at the end of the day, and that change has to come on the 7th of May. We have to get a Labour government back into Westminster. But we in the European Parliament, we're not in Purda, we're not out on the campaign trail in the same way between now and May. We're fighting for the NHS in the European Parliament, fighting against Tory attempts to lock in their privatisation through international trade agreements, fighting against the inclusion of our public services in the Transatlantic Trade and Investment Partnership, TTIP. And we're fighting because that's what our constituents have asked us to do. So we're joined up, we're fighting locally to keep the Jarrow Walk In Centre open, we're fighting nationally to repeal the Health and Social Care Act, and we're fighting in Europe to avoid that we have this privatisation locked in, that we can't reverse it in the future. It's so important that we have that joined up approach. It's only with that joined up approach that we can show that there still are folk with the faith to fight for the NHS, and we're not willing to give up and to sell off our public services. Thanks very much.
Thank you, Jude. Thanks again for your message of support. Our next speaker is Joanne Land from an NHS called 999 Call the NHS. Could I have Joanne, please?
My name is Joanne Land, and I'm one of the founder members of 999 Call for the NHS, and one of the Jarrow mums who organised the original People's March for the NHS. I'm very, very pleased to be back here today to be able to speak to you all. We passed the baton of the People's March for the NHS on, and at least that saves us a job. I believe that the people of Jarrow should be the ones to speak about it on this platform, so I will focus on what needs to be done to save our NHS. None of you need to be told what 5 years of Tory government has done to the NHS. You can see it here in Jarrow with the proposed closure of your walk-in centre. You can see it in the failure of Hinchinbrook Hospital. You see it in the tragedy of the people who die waiting for ambulances that could have saved their lives. Ambulances that are now not infrequently little more than fluorescent transit vans with the Red Cross slapped on them. What has happened to the NHS in the last 5 years has been nothing short of devastating. Now, 999 is about policies and not parties. But I have to tell you this. When we walked 300 miles from Jarrow to London, the Labour leadership, the PLP, were all over us. They loved us. When we reached Trafalgar Square, they announced that they were going to repeal the Health and Social Care Act, that they would protect the NHS from TTIP, and that they would make the NHS the preferred provider. Well, we didn't walk 300 miles for that, because it's not nearly enough. The NHS cannot be excluded from TTIP until it is completely renationalised, and they have no plans to do that. Preferred provider status will not stop the private companies' encroachment on our NHS. And the repeal of the Health and Social Care Act will help, but it will still not prevent private companies from fragmenting our NHS. And I'm going to read you a short passage from Bevan that doesn't get aired very often, from Hansard. When Nye Bevan resigned over the introduction of dental and optical charges, he addressed the Labour Chancellor, Hugh Gateskill, and he said, "If the Chancellor finds it necessary to mutilate or begin to mutilate the health services for 13 million out of 4,000 million, what will he do next year? Where do you stop? And indeed, what answer will they have if the vandals, the Tories opposite, come in? The health service will be like Lavinia, all the limbs cut off and eventually a tongue cut out too. Those who live their lives in mountainous and rugged countries are always afraid of avalanches, and they know that avalanches start with the movement of a very small stone." Now, Bevan's words are even truer today. A lot of stones have been moved, and just as in Bevan's day, many of these stones were set in motion by the Labour Party. The time has come for the Labour leadership to halt all of these stones by pledging to renationalise the NHS and put it in public ownership and publicly run, publicly funded. Because this is the only thing that can prevent the coming avalanche. All of us who are in the Labour Party need to demand this of the leadership, and the leadership need to back the NHS reinstatement bill. Why not? They need a pledge to end the PFI schemes that are crippling the NHS. They have to oppose austerity, and they have to refuse to sign TTIP. 999 and always has been about policies and not parties. Because it's your vote, we're not here to tell you who to vote for. And at the core of what we do is a mission to speak the truth about party policies on the NHS. Vote however you will to save the NHS, but vote without illusions. The NHS was born in an era when the ruling class feared us. The Tory politician Quentin Hogg said in 1943 that we must give them reforms or they will give us revolution. Now the outcome of this election will have a great influence on whether the NHS goes to the intensive care unit or to the grave. But by far the most important factor is you, all of you. We won't save the NHS unless the politicians fear us, unless they fear you. If they don't fear you, we won't save the NHS. So get angry, get out in the streets, occupy and strike. The most valuable power we have is to withhold our labour power. Because if they don't fear us, the NHS will eventually die. So demand the NHS, demand our NHS, and demand Jarrow Walk In Centre. Thank you.
Thanks very much, Joanne. The Public Service Alliance has been also grateful for the support of Unison Northern Region during this campaign, and I'm delighted to say that the chair of the Unison Northern Region Health Group, Linda Hobson, is here to speak to you. Thank you.
Thank you, Merv. And thank you for the opportunity to come along and bring solidarity from NHS workers from across the region to you in our campaign today. Let's be clear, our NHS cannot survive another 5 years under a Tory government. That is the truth. A Tory government is no friend to our NHS. A Tory government that talks of devolving power to local communities, but as you have all seen, the reality is very different. This community spoke out against the closure of the walk-in centre. You know what it means to local people in your communities and the impact that it's going to have on those people. This government chose not to listen to you, but you are still continuing your fight. We saw Cameron on TV on Thursday night trying to defend the indefensible, his government's shambolic handling of the NHS. Let's just look at their track record. Remember, back in 2010, a promise that the NHS will be safe in David Cameron's hands? Let's explore the Tory version of safety. Over £3 billion wasted on an unnecessary top-down reorganisation of the NHS, which the Tories have themselves admitted was a big mistake. And it's worth remembering that they were only able to do this because of the Lib Dems. A reorganisation that many feel has led to a lack of transparency and accountability when decisions are made about NHS service delivery, and you have seen this firsthand. Attacks on our NHS staff have reached a staggering 60,000 a year under the Tories. £700 million have been wasted on private consultancies since 2012, money that should have gone towards patient care. NHS Direct, no more. 73% of our nursing staff report an increase in stress levels and lower morale as they struggle to cope with the impact of the Tory mismanagement of our NHS. 180,000 plus operations cancelled at the last minute. A massive shortage of nurses and midwives. Over 7,000 NHS beds axed. An A&E crisis that has seen ambulances and patients queuing up outside hospitals. Within the NHS, we are used to seeing increased activity that we call winter pressures. Under this government, it's more of a Vivaldi 4 seasons of pressure. A massive crisis in the ambulance service. Waiting time targets for A&E, hospital treatment and cancer care are all being missed towards the end of this Parliament. Public satisfaction with the NHS has gone from record highs to lows. The irony of massive staff shortages in the NHS and yet spending on temporary agency staff has climbed 50% in 2 years. NHS staff at this moment within our region not knowing whether they will have a job come April the 1st as services are being transferred, staff are being left in limbo. This government do not understand the value of our NHS to our communities, but they do understand the value of the NHS to themselves in terms of financial gains and profits. Since they voted to sell off our NHS, £12 billion of our services are now in private hands. These include vital clinical services such as cancer care, blood services and mental health services. It is estimated that around £1.5 billion in health contracts have been paid to private firms with links to Conservative MPs and Lords over the past few years. We listened to Cameron say he's protected the NHS. Utter nonsense. You cannot claim to be protecting the NHS when massive cuts to our local councils have led to cuts in social care budgets, when we see the most vulnerable people in our society being looked after by care workers made vulnerable themselves, relying on unreliable, exploitative zero-hour contracts, in some instances flouting minimum wage rules by refusing to pay travel time. Zero-hour contracts that are not good enough for Cameron? No, he couldn't survive on one. After all, Fortnum and Masons do not do a smart price range. And yet, 0 hours contracts have played a major role in his economic policy. This government's policies make people more dependent, makes people ill. Look at housing policy, where they have refused to tackle exploitative landlords, where housing conditions are so bad it leads to chronic illnesses or exacerbation in existing illnesses. This government has no regard for early intervention programmes that prevent people getting ill or pick up illnesses in their early stages before it becomes serious. Closing this walk-in centre proves that. When NHS staff stood up to the government last year at their refusal to honour their measly 1% pay award for all NHS workers, they weren't just standing up for their own interests. They were standing up for you, for your NHS, an NHS that is dependent on committed and well-trained staff, staff who work thousands upon thousands of hours a year as unpaid overtime, who this government are quick to blame when their own policies fail, when they pressurise NHS organisations to continuously deliver more for less and pit NHS trust against NHS trust. A large portion of financial savings made by NHS trusts has come out of the pockets of NHS staff. As a trade union rep, I have seen more and more members coming to us with problems such as homelessness, homes being repossessed, needing to access food banks, struggling to heat their homes, and even to buy uniforms for their children. Members have told us how they have felt forced to take out payday loans for necessities and then taking out another loan to pay off that loan, very quickly becoming trapped in a spiral of debt. I could go on, but instead, let's call time on this government. Let's give them their marching orders. Days like today are our opportunity to send a clear message to this government that we will not be silenced. Fights like yours prove that we will not just sit back and watch them decimate our NHS and the staff who work within it. As I have said, our NHS cannot survive another 5 years of a Tory government, and we can make sure it doesn't have to. The message we send is simple but clear. Never, ever, ever trust a Tory with our NHS. We have 39 days to save our NHS. 39 days until May the 7th. And people like you and people like me have got power to get the message out. And this is doubly important when we hear people saying that they're going to vote UKIP. A Tory UKIP coalition would be disastrous. The answer does not and never will lie with UKIP and Farage's attempts at popular politics. You'd be forgiven for thinking that UKIP's health policies lie in smoking tabs and drinking beer. UKIP who believe in an American-style insurance-based health service. UKIP who believe in dividing our communities and scapegoating immigrants. UKIP's whose only 2 MPs are former Conservative MPs funded by Tory voters. The phrase more Tory than the Tories comes to mind. Farage is as dangerous to the north as Thatcher was. He and his party are no friends of the working classes. Let's be clear, Farage is a public school boy, millionaire commodity trader, ex-Tory who loves Margaret Thatcher, is funded by ex-Tory billionaire bosses and who changes his party's policies every time he's challenged on them. It's no wonder he's always laughing and smiling with a pint in his hand.
He probably can't believe he's gotten away with it for so long. It is important that we all make sure we are registered to vote. You have until the 20th of April to check that you and your friends, your family, your colleagues are all registered to vote. As a trade union rep, I'm used to fighting to protect jobs. However, I am committed, as I am sure you are, to ensuring that Cameron and his cabinet are well and truly out of a job come May the 8th. I'll be voting on May the 7th. I'll be voting for our NHS. I'll be voting for our public services. And only by voting for our public services can we get rid of these blue and yellow Tories. Kick them in the ballot box. And then we can get to work repealing this Health and Social Care Act, ending the love affair with privatisation and fragmentation of our NHS, and making sure the NHS works for us rather than the profiteers. Thank you.
Thank you, Linda. The message is really clear, isn't it? Thanks very much to all our speakers today. I think some great contributions, obviously, in terms of the local issue of the walk-in centre and the wider issue of how to save our NHS. But thank you to all of you, because all of you and your presence here today sends the real message that people do care about their services, people do care about their NHS, and people want to see that they can have those services and not have them taken away by unelected bureaucrats. So the message is clear. The fight goes on to the general election, and the fight goes on to make sure that whoever is the next Secretary of State for Health, that this walk-in centre needs to be saved and needs to be kept. So thank you all very much for your support today, and thanks very much for coming.